Hello everyone, I am Dr. Suraj Chirania, hematologist, hemato-oncologist and bone marrow transplant physician. Welcome to our YouTube channel where we break down complex blood disorders into easy to understand facts. Today we are talking about lymphoma diagnosis, what tests are needed and how doctors confirm the diagnosis. If you or your loved ones one have a persistent lymph nodes, knowing the right step for diagnosis can be life saving. So let's go through these 5 essential steps to diagnose a lymphoma. First is clinical examination. What doctors look for is lymph node size, consistency. Large painless firm nodes are concerning. Location of swelling. Nodes in the neck, armpit or groin may indicate lymphoma. Whether it is associated with these symptoms or not, symptoms like fever, night sweat, weight loss are the red flags. Spleen and liver enlargement we check in the clinical examination. Second, clinical examination is followed by a blood test. The first clue, the blood test helps screen for abnormal signs of lymphoma. We check complete blood count, detects anemia, low WBC or abnormal lymphocytes, LDH and ESR level. High levels suggest active disease. Flow cytometry examines the immune cell markers to detect the abnormal lymphoid cells. Viral markers like EBV, HIV, hepatitis, some viruses are linked to lymphoma. Third is imaging, checking the spread of lymphoma. Scans help determine lymphoma staging. The scan usually we do is CT scan, and if available, PET scan. PET scan is now standard of care, shows the size and location of enlarged lymph node. PET scan specifically highlight the active cancerous node versus the benign swelling. MRI, if needed, used in lymphomas mainly affecting the brain and spine. A PET scan is crucial for determining how far the lymphoma has spread. Fourth, lymph node biopsy, a gold standard. To confirm a lymphoma, a biopsy is necessary. The excision biopsy is the most preferred, where the whole lymph node is removed for analysis. Then over needle biopsy done when surgery isn't possible. Immunohistochemistry is the most common test that differentiate between two types of lymphoma, that is Hodgkin lymphoma and non-Hodgkin lymphoma. They can't be diagnosed without a biopsy. Fifth is bone marrow biopsy for checking for the spread of lymphoma to the bone marrow in advanced diseases. Bone marrow biopsy confirms the marrow involvement and it helps guide treatment decisions, especially in the aggressive lymphomas. This test is needed only in some cases depending on the imaging and the blood results. So, final takeaway is early diagnosis is key. If you have persistent, painless swollen lymph node, don't ignore them. A biopsy is the only way to confirm lymphoma. Early detection improves the survival. If you have B symptoms or abnormal scan, see a hematologist immediately. That's it for today's discussion on lymphoma diagnosis. If you found this helpful, like, share, and subscribe for more hematology content. Got a question? Drop them in the comment box. Thanks for watching our YouTube channel. Stay healthy, stay informed, and see you in the next video.